Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 55, and this is RNA means random questions in neurology and neurosurgery, and this is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for the public awareness. In this series, the question that I'm addressing is, how is sacroiliac joint dysfunction identified on physical examination in the bedside or at the bedside? This is very important for the neurosurgeons when they examine the patient to differentiate between lower lumbosacral, that is lumbar L5 S1 disc prolapse, and the sacroiliac joint involvement. So, how is sacroiliac joint dysfunction identified on physical examination at the bedside? There are certain signs which can be elicited at the bedside. One is the Fortin's sign, that is tenderness when palpating the sacroiliac joint. Fortin is John D. Fortin, a clinical researcher known for his work on sacroiliac joint. The second one is a pelvic distraction in supine position. Application of posterior pressure on both the anterior superior iliac spine joints simultaneously causes pain in the sacroiliac joint area posteriorly. That is pelvic distraction test. Then there is the compression test. In the lateral recumbent position, application of pressure directly down on the superior hips lateral aspect causes pain in the sacroiliac joint posteriorly. So, Fortin sign, pelvic distraction sign, and the compression test. The fourth one is the Faber test. Now, Faber is an acronym. Flexion, F, A, B is abduction, E, R is external rotation. So, that is FABER. This was described by Robert W. Patrick, an orthopedic surgeon, and is also called as a Patrick test, a maneuver for the hip and the sacroiliac joint. Here, the patient lies supine. You place the test leg, that is at the fixed, abducted, externally rotated. Apply gentle downward pressure of the knee. Externally rotated means you place the angle over the opposite knee. So, you flex, place the test leg in what you can say abducted position, then what you can say flex externally rotated. That means angle is over the opposite knee. And then apply gentle downward pressure on the knee of the tested leg and opposite pelvis. You fix it. The pain in the groin, such as hip joint pathology, osteoarthritis, pain in the posterior buttocks, SI region, that is the sacroiliac joint region, such as sacroiliac joint pathology. So, Patrick sign is a very important sign that can be, or Patrick test is a very important test at the bedside to distinguish between a hip joint pathology and a sacroiliac joint. It's a very important Patrick sign. It's a very simple bedside test. It helps differentiate a hip versus a joint pain of the sacroiliac joint pain. Then there is the thigh thrust in supine position with a contralateral hip flexed and stabilized. Application of the pressure down on the anterior superior iliac spine of the ipsilateral affected side causes pain in the affected sacroiliac joint. So, that is the thigh thrust. Then there is the Ganslen's test, Gaenslen apostrophe test. Ganslen's test is named after Frederick Julius Ganslen, an American orthopedic surgeon known for describing clinical tests for sacroiliac joint pathology. Now, how is the test performed? Patient lies supine near the edge of the table. One hip is maximally flexed towards the chest and the other leg is extended off the table. And the flexed hip will be further flexed and extended hip will be further extended. This creates a torsional stress in the SI joints and there will be a pain in the sacroiliac joint. That is a positive test. It suggests sacroiliitis or SI joint dysfunction. So these are some of the bedside tests to elicit us or to find out whether the patient has a sacroiliac joint pathology. For Tinstein, pelvic distraction, compression test, Faber test, thigh thrust test, and Gansland's test. That's indeed the answer for this particular question. Thank you. Thank you very much.